Well, first of all, I'd like to say that I'm going to stay on time, Ruth. But I would like to say that I'm very passionate about nutrition, being a dietitian. And you're probably all thinking, oh, she's going to go on about, eating in a certain way. But this is really a practical session, and it's around looking at what sort of areas we can utilise, and also some clear messages as well that people can use. So in terms of what I'm going to speak about today, well, it's about oral health and nutrition, and oral health is essential to good nutrition as it impacts on the health of the gastrointestinal tract, and I think we all know that. I should put my slide up as well. Is that working? Yes? It's not. Oh, yes. So in terms of the gut, it's basically the window of the body, so it's a very important area, and of course we're starting with the mouth. So if I'm seeing people in community health who are unwell and they're coming in and they're saying that they can't eat as well because of their teeth or their dentures aren't fitting properly, then they're going to have problems with their health overall. So it's a really important role that the dietitian is involved in, and that is one of the reasons why the Dietitians Association and the and Dental Health Services Victoria got together to write a collaborative paper, a joint position statement on oral health and nutrition to assist with the role of the dietitian in this area, but also to give some clear, consistent messages as well, because we're very involved in health promotion, so that's a very clear role. And also we're really involved with multidisciplinary approach and working with other teams, and at North Richmond Community Health we are very much working in teams and working collaboratively as well between dental health, between allied health, between GPs, paediatrician, counselling. So we have a whole very holistic approach to working with our clients. So that's why in terms of the joint position statement, the dietitians had a really clear role to be working with oral health practitioners, and to be the multi-directional referrals between each other is very important. So also I'm going to look at the role of the dietitian as well in that area, and explain as well some of the development of the oral disease. I'm not going to go into that in very much detail, Ruth, because otherwise I'll be over my 20 minutes. So also the successful collaboration between two professions was really important, and addresses the major public health issue, as we've all heard this morning as well. So I'm going to look at examples as well of working collaboratively between dietitians and oral health professionals, but also in a holistic way. So just some scenarios at the end to encapsulate that area. So in terms of now I'm going the wrong way, the joint position statement on oral health, I wasn't actually involved in that process, but I have been provided with some information on the fact that they met together, and then a joint position statement was released in October 2015, and it was presented at the Dietitians Association of Australia National Conference this year as well. And it was developed in response to the need for nutrition and oral health professionals to work together in oral health promotion. Now I've turned it off. That's good. So the aim of the position statement is to provide evidence-based oral health information for dietitians and guide how oral health can be incorporated into the various roles of dietitian, and also to provide a framework for building the capacity of the workforce, which we've heard about this morning as well. So in terms of oral health and nutrition, so we have been through some of this today, and the statistics are really startling in terms of the amount of tooth decay, and particularly in my role as a dietitian, and I'm seeing a lot of paediatric clients, the nutrition component of it is really an important area, and I'm seeing a lot of children with tooth problems or tooth decay, and also that they haven't seen their dental health professionals as well. So it's a really important area. So the joint position statement has been developed in response to oral conditions being the second most expensive disease group to treat, as we know, next to cardiovascular disease, with about 7% of the total health budget spent on dental treatment in 2012-2013. So, for example, the prevalence, there was 1 in 2 12-year-olds having tooth decay in their permanent teeth, and 3 in 10 adults aged 25 to 44 had untreated tooth decay. So I guess the important part, if there's concerns or problems with oral health, then the quality of life is affected, and the burden of the dental treatment and the effect on general health and wellbeing has a significant impact on the individual and at the population level. So in particular, we look at areas such as the amount of sugar, so sugar in the form of sweetened beverages, sugary snacks and processed foods, and that increases the risk of dental caries, dental erosion and weight gain, contributing to the risk of chronic disease. So according to the World Health Organization, oral health and nutrition are determinant factors for quality of life and essential for good general health and share common risk factors. Problems that occur in the mouth can negatively influence the ability to bite, chew and swallow food, and most importantly enjoy food. So people aren't going to be enjoying food if they're having problems with their teeth and they're in pain, or they've lost their teeth and they're not able to chew the food as well. So it also causes pain and impaired growth and problems with nutrition. So we see malnutrition and restricted activities. And there's increasing evidence that oral health is significantly associated with the major chronic diseases, as we've discussed. So the dietitian's role in oral health is very much a practical, evidence-based food and nutrition information. Sounds very boring, doesn't it? But it's actually it's a wonderful role because we get to talk about food all the time, which is really nice, and not just about, not having any chocolate at all. So we do talk about other things like that, and we do enjoy that sort of area. And I was really happy to see at morning tea that you're having yogurt and fruit, and yes, it was a good way to start. So the dietitian plays an important role in oral health due to their role in nutrition promotion, because they're already talking about the gastrointestinal tract, including the mouth in relation to food, nutrition and the ability to eat. So they're already talking about that. So often it's a way, I guess, of screening. So you might find out that we're asking the question, how are your teeth? In terms of, whether or not your dentures are fitting, and then we'll refer them back up to dental health. So that's the multi-directional part of our role. Dietitians provide a role in community health which is client-centred, it's holistic and includes a comprehensive assessment and support and referral to other services, and we work within a multidisciplinary team. So the dietary factors for oral health are to reduce free sugar intake. So that's not free as in that, it's a free, you don't have to buy it. It's that it's within the food. So there's lots of foods in of course, our manufacturing industry is adding a lot of sugar into foods. So the key ones are the sweetened drinks, so like soft drinks, energy foods, and also the muffins, cakes, processed foods as well. So that's and our energy drinks as well are really key areas. So free sugars are sugars added to foods and drinks such as the lollies, soft drinks, cakes, biscuits, or they're naturally present in foods like honey, maple syrup and fruit juices. Also lactose included in that, and that milk sugar, but it's less cariogenic due to the presence of calcium, which has a protective effect on teeth. So that's why it was good you had your yogurt this morning. And it's recommended to reduce the amount and frequency of free sugar intake, as this contributes to poor oral health, weight gain and chronic disease. And the form and physical consistency of the food is important for oral health, as sugary and acid foods that are liquid, solid or slow to dissolve are more damaging than those that can be dissolved and washed away quickly. And I guess an example I see is with adolescents, and they're playing a lot of sport, might have just completed a netball game, and they'll drink some energy drinks like Gatorade, which they don't actually need, contributing to obesity, and also they're sipping on them for long periods of time. So that's causing problems in terms of increased risk of dental caries. And foods and drinks that are acidic can cause loss of enamel by dental erosion, and that's the example in terms of energy drinks, fruit juice and fruit-flavoured lollies. So people will pick up a packet of fruit-flavoured lollies, the package, and it says fruit, and they think that's healthy. But it's very damaging in terms of tooth decay and also in terms of their weight. So in terms of the WHO, they released a statement, and they developed guidelines on sugar intake for adults and children to reduce the intake of free sugars to reduce rates of obesity and dental caries. And they recommend reducing the intake of free sugars to less than 10% of the total energy intake, and suggest a further reduction of the intake of free sugars to below 5% of the total energy intake. So 10% is about 12 teaspoons, and that's average for the adult. But we're seeing a lot higher intake than... So from free sugars, in terms of our intake, 52% of Australians exceed that WHO recommendation. 12 to 18-year-old males had an average of 22 teaspoons of sugar per day, but it was in some of the research or studies, it's been up to 38 teaspoons per day. So half of the free sugars are from the beverages like sports drinks, sport and energy drinks, fruit juices and veggie juices and cordials, but also the muffins, cakes, biscuits. Also ice cream was another one that was listed. So in terms of the practical approach, and this is what was included within the joint position statement, so there's a consistent message. So in terms of health promotion, that we're all saying the same thing. The protectors were listed as if fluoride, calcium and casein, xylitol and sugar-free gum, and fresh fruit and vegetables. And I guess touching on the fresh fruit and vegetables, only about 4% of the population of children and adolescents and adults are basically meeting the guidelines of 2 fruit and 5 veg per day. So that's a really significant problem. And we know that the fruit and vegetables are really protective against dental caries, but also for obesity, chronic disease, so it's all interrelated. So the protective features, so milk products is one key area. So casein is protective and stops demineralisation. Casein phosphate peptide in sugar as well. Sugar-free gum increases the saliva flow, so it's protective. And fresh fruit and vegetables, so vitamin C for periodontal health and also to promote saliva production. So the dietary influences on decay rates include areas such as the amount of fermentable carbohydrates consumed, physical form of carbohydrates, the concentration of the simple sugars in the foods eaten, such as the sweetened drinks, and length of time the teeth is exposed to the acid, so if you're sipping on it all day. And the other example I use is I often see children with their squeezy pouch of food, and that's including sugar in it, and they're sitting there and they're squeezing it into their mouth all day, or they're having lots of fruit juice as well in bottles. So that's where they're being exposed to that fruit juice or acid all day. Frequency of eating meals and snacks is really important, and the length of interval between snacks and meals, and the proximity of eating before bedtime, and also milk bottles overnight. Although the dairy products or the milk is protective, but also if it's sitting there on your teeth all night, then there's an increased risk of dental caries as well. So the dietary recommendations are limiting sugary foods, which we all know about, especially between meals. So if there's more time that the tooth is exposed or teeth are exposed to sugary foods, then there's more risk of dental caries. And we're finding that as the years go by, in terms of research, so from the 90s through to 2000, there were some studies completed, and there's an increased number of snacks that people are having per day, so that's increasing the risk as well of dental caries. So choosing healthy food between meals, for example, fruits, vegetables, cheese and yoghurt, and encourage small amounts of cheese after the meal. But also, of course, cleaning your teeth as well is very important. So I thought of some scenarios that we would see within community health. And so in terms of, these are just some of the clients that I might see. I had referred an overweight child who was 9 years of age, and They were referred by oral health professional. They had dental decay. They were also eating a lot of high sugar, high fat foods, and they're having lots of frequent snacks. And also they were having inadequate dairy. So we know dairy is protective. And so on assessment, they were having a lot of muffins, cakes and breakfast cereals, which were really high in sugar, so like a Milo cereal as well, sweetened drinks. And they had an inadequate fruit and vegetable intake and low calcium intake. So after assessment, the nutrition education was provided to the parent-child, and then on 6-month review, the oral health professional had noted that there's been improved oral health generally and no new caries, because they were referred back up to, so between the two professions, so between the oral health professional and the dietitian. So another scenario I might see is a toddler, 2 years of age, and they're referred by maternal and child health. They're having night bottles, so milk sugar on the teeth all day, milk during the day instead of solid foods. So Ruth, this is your fussy eater. Consuming inadequate iron foods, and in terms of the fussy eating, they're not eating during the day, so therefore they're having a really low iron intake, but also they're not eating fruit and vegetables, which are protective. So they were also referred to oral health professionals, so that's our multidisciplinary approach, so we're working all together within that area. And on review, she'd attended appointments with the dental health professional, and her parents had ceased providing bottles overnight and during the day, and had an increased variety of food because she was hungry, because she wasn't filling up on milk. So, and another scenario I saw was a 37-year-old male who had teeth removed and dentures and had sore gums, but lost 12 kilos over 3 months, so was underweight at that BMI, still had a high sugar intake from excessive soft drink, wasn't eating well, was having difficulty eating, so I referred back to the oral health professional. And on review, though, it had decreased weight again, so we referred to the GP as well, because there were other underlying areas happening there. But as a dietitian's role, we were looking at things like he was having irregular meals, low fruit and vegetable intake, low dairy product intake, and once the dentures or that area was improved, then they could eat those foods again. So recommendations is refer to the joint position statement for evidence-based practical information. I think that's really important between the two professions to work together, and also that we're having a clear, consistent message, and facilitate the multi-directional referrals between the dietitian and oral health, and further develop the collaborative partnership of screening and referral pathways. So that's something that we're looking at as well at North Richmond Community Health. And so we can incorporate simple oral health messages in all our work to encourage good oral health practices and screening, as well as food selection and eating patterns, and reduce the consumption of free sugars and reduce snacking. So they were just the references that I used for the presentation. Thank you.